Today we're going to talk about the anatomy of the heart, and I thought what I would do to get us started is draw the most anatomically correct heart that I could, and after this we're going to draw a much simpler version, the more familiar cartoon-looking heart. So in this picture of the heart, I just want to label the basic structures. So we have the right atrium, the right ventricle, the left ventricle, and the left atrium, which is not so visible in this picture, but sort of sits almost pointed towards the back. Also, what you can see is I'm going to label the base of the heart, and the base refers to the point of attachment. So all of the great vessels that come sort of off the top of the heart are what comprise the base, because that's what keeps the heart sort of in its stabilized position. And then towards the actually the bottom of the heart, maybe the pointiest portion, we actually call that the apex. And I would just want to point out that it's opposite of how we label the lungs. So just keep in mind, base for point of attachment and apex for the free portion that's actually at the very bottom. Now, I'm not going to talk too much about the vasculature that comes out of the top of the heart in this drawing, because there's going to be a later drawing that focuses on that. But what I do also want to discuss is the position of the heart in the chest cavity. So there are three primary components to the position of the heart in the chest cavity. One, it's slightly left of the midline, and we refer to the midline as the sternum. And when we say to the left of it, we're actually talking about the center of the base. So the center of the base is slightly left of the midline, or slightly left of the sternum. Number two, the apex points diagonally to the left. So sort of towards the, like almost to the left of the left foot a little bit. And number three, the heart is slightly rotated on its axis towards the left. So if you imagine sticking a pencil or some sort of cylindrical structure through the middle and then just sort of spinning it just a little bit to the left, we would make it so that the right atrium and the right ventricle are slightly more prominent or more anterior. Okay, so here it is down below once again. Heart positioned slightly left of the midline, pointing diagonally to the left, and then lastly rotated on its axis slightly to the left so that the right side of the heart is more prominent. The other thing I want to mention briefly is the mediastinum, and I think we've talked about this a little bit before, but I want to just review it quickly. So the mediastinum refers to the area between the pleural cavities, and it contains the heart in the anterior portion, as well as things such as the great vessels, the thymus, the esophagus, the trachea. So I'm just going to list a couple of them. Those are the ones we want to definitely remember, and just be familiar with the word. Okay, so now I'd like to talk a little bit about the linings that cover the heart, and we've discussed this briefly before, but we're going to expand on it now. So here's the heart, and then here's our visceral pericardium, so the portion of the serous membrane that lines the heart specifically. And actually, we're also going to now call it the epicardium, and we'll do the inside of the heart second, but the epicardium is the outermost portion of the actual heart, and that's going to be a serous membrane. The second thing I want to mention is the parietal pericardium. The parietal pericardium is what lines the cavity, and of course we know that the serous membrane is actually two layers of membrane with fluid in between, and so the pericardial fluid sits in between the two linings and allows for the heart muscle to move around in the cavity without generating friction. Also, the fluid provides a little bit of cushion. Normal amount of fluid is about 15 to 50 mLs. And certain types of diseases such as pericarditis, which would be inflammation of the visceral and parietal pericardium, can cause the layers to actually touch each other and rub together, and this could progress to an increase in the amount of fluid, and among other reasons that progression could become cardiac tamponade. And I also want to mention the pericardial sac, which actually is the fibrous pericardium, and that's the black lining around the outside. And we can consider the parietal pericardium as the inner lining of the fibrous pericardium. So there's actually a few more layers than we discussed previously. All right, so now let's consider the inner components of the heart. So we know the heart is in some aspects hollow because it allows blood to flow through it. So the blood is going to sit in these chambers that I'm drawing here, and then the white space in between the chamber and then the outside lining of the heart is going to be considered the myocardium. So most of the heart itself is myocardium, and that just basically means heart muscle. And this inside layer the lining is the endocardium, and that's going to be the innermost layer of cells before the actual hollow space or chamber starts. So myocardium is muscle layer. Myo meaning muscle and cardium meaning heart, so heart muscle. And it's comprised of many cardiac muscle cells. And then in addition to that, there are some blood vessels and nerves that are intertwined within this tissue layer. Now the endocardium is basically a single layer of cells, and it's simple squamous epithelium. And of course we know simple means a single layer. And the endocardium is actually continuous with the vasculature. So as things like the aorta or the pulmonary vasculature sort of merge with the heart and the blood is going to leak through them, that layer of simple squamous epithelium that's on the inside is going to continue and be the inner layer of the blood vessels that are leaving the heart as well. All right, so let's take a look at the very simple drawing that will normally be how we represent the heart. So heart shape, divided into 4 chambers: right atrium, right ventricle, left ventricle, and left atrium. And what you can see is a passageway between the atria and the ventricles as well. So I want to talk about some structures that are present that we could see just by drawing the diagram like this. And the first one is this thing called an auricle, and there are 2 of them. The auricle is an expandable extension of the atria. So basically, as blood fills the atria, the auricle is able to expand to receive the blood. And then once the blood is propelled into the ventricle, the auricle will then sort of flop over when it's empty again. Second thing I want to mention is the separation between the 2 atria, and that separation is referred to as the interatrial septum. The separation between the ventricles is called the interventricular septum, and both of those structures are basically muscular partitions, so just muscle that separates the chambers between the right side and the left side of the heart. And the last thing I want to mention is the AV valves. So AV valves, it actually stands for atrioventricular valves. And those are like one-way doors for blood to flow between the atria and the ventricles. So from the atria to the ventricles, but not the other way around. And actually the AV valves provide electrical insulation to separate the atria and the ventricles. And we'll talk more about this particular function in a later video, so when we're discussing the conduction system of the heart. All right, now the last thing I want to do is basically draw the flow of blood through the heart. And classically we start with the right atrium. And one thing I'm going to mention is that we're going to sort of do the right side of the heart and then do the left side of the heart and consider them independently. But what's important from a global perspective standpoint is that the blood actually flows into the right atrium and the left atrium at the same time, and the flow of blood between the atria and the ventricles is also simultaneous. So I think it's kind of deceiving, but it's just an important point to consider, especially since we're going to not draw it that way in this video. So we'll consider first, keeping in mind the drawing that we have before, we'll consider first the right atrium, and so I'm just going to draw that all by itself. And what you can see is 3 blood vessels that are leading to the right atrium. The first is the SVC, or the superior vena cava, and that collects blood from the head, the neck, the chest, and the upper limbs to deliver to the right atrium. The one on the bottom is the inferior vena cava, or IVC, and that delivers blood from the trunk, viscera, and lower limbs. And then lastly, there's the coronary sinus, which is going to deliver the blood from the cardiac muscle circulation. So we'll talk about the coronary arteries in another video as well, but the coronary arteries will distribute blood to the heart, and then they will eventually bring their blood back to the cardiac veins, and the cardiac vein will dump into the coronary sinus. Now, it's important to note that in terms of the orientation of these vessels, they all enter the right atrium from the posterior. So they're essentially sitting sort of behind the right atrium as they deliver the blood, and then there are just some holes for the blood to pass through that you can see. Okay, so let's move on and talk about the right ventricle. So from the right atrium, the blood is going to flow through the AV valve into the right ventricle. And so we'll start by drawing the AV valve here. Now the AV valve on the right side of the heart is made of 3 cusps, or 3 flaps of tissue. And because there are 3 of them, we call it a tricuspid valve. And the tricuspid valve is anchored. First, there are papillary muscles that sit towards the bottom of the ventricle, and then the papillary muscles connect these things called chordae tendineae, so essentially heartstrings, to the cusps. So as the blood flows from the right atrium to the right ventricle, it has to flow through the AV valve, and once the blood has accumulated in the ventricle, the cusp will, for a number of reasons, and we'll discuss these again separately, the cusp will want to sort of pull back on itself and actually close that door. And what we want to make sure about is that it doesn't flip the other way and allow the blood to flow back to the atrium. And so the function of the papillary muscles in the chordae tendineae is to anchor the cusp so that they can't swing in both directions. They can only open for the blood to come through, but they can't go back the other way. Now we said that the blood is flowing in to the right ventricle through the SVC, IVC, and coronary sinus. Here it comes down into the right ventricle, and then from the right ventricle it has to go out. And the point of exit is actually through the pulmonary semilunar valve. And so it's a little different than the AV valve, different in structure, different in name, but it's going to go through that semilunar valve, and it's going to enter the pulmonary trunk. All right, so here's our pulmonary trunk, and the pulmonary trunk is going to separate into right and left pulmonary arteries, and actually there are 2 pulmonary arteries that are on the left side, and there are 3 on the right. And then of course the aorta, we just mentioned the aorta because the relationship between the two structures is that they're right next to each other. Here's the pulmonary semilunar valve. That is what guides the blood flow. So blood flows through the semilunar valve, and then it'll prevent backflow back into the heart and allow the blood to continue moving forward. The last thing I want to mention is a structure called the Ligamentum Arteriosum. And so basically it is a remnant of fetal circulation. So we'll talk about fetal circulation separately in much later in the course. But during fetal circulation, there's a hole that allows for blood to flow between the pulmonary trunk and the aorta. And after birth, that hole is going to close, and it actually just becomes this ligament that connects the pulmonary trunk and the aorta. And just a little tidbit on the significance of the ligamentum arteriosum in trauma, particularly an example would be, like a motorcyclist into a tree. Any trauma that presents a significant shearing force can cause this ligamentum arteriosum to pull and sever from the aorta, causing the aorta to rupture open, and that would result in significant rapid loss of blood and most probable death. So now we've kind of already talked about pulmonary circulation with regard to exchange of oxygen and carbon dioxide in the pulmonary capillaries between those in the alveoli, but just for the sake of considering this in connection to the heart, we'll have blood flow through the pulmonary arteries. Eventually they will break into teeny little capillaries in the lungs, so that there will be gas exchange at the lungs, and then the blood flow will come back to the heart via the pulmonary veins. So now we'll consider the left side of the heart, and we'll start with the pulmonary veins. So here is the left ventricle, and there are 2 pulmonary veins that come back from the right side and 2 pulmonary veins that come back from the left side. And similar to the right side of the heart, these vessels will enter the left atrium posteriorly. The blood will flow into the left atrium, and then it will progress to the left ventricle. Now, just as before, the blood has to flow through an AV valve in order to get into the left ventricle. In this case, there are only 2 cusps that comprise the AV valve, and so we actually call this the bicuspid valve. It's also called the mitral valve, and it's actually named that because it looks a little bit like a mitral hat. And you can use either terminology, whichever you prefer is easier. Similar also to the right ventricle, the cusps are anchored by papillary muscles and chordae tendineae for the very same reason, so that we don't allow backflow of blood through the heart. Now the blood is going to flow from the left ventricle into the aorta. And so here's our aorta. We start with the ascending aorta coming, working its way upwards. Then we have the aortic arch. And then lastly, the descending aorta. And the descending aorta extends into the abdomen. Also similar to before, there is a semilunar valve that separates the ventricle from the aorta. And in this case, it's called the aortic semilunar valve. Same basic structure as the other semilunar valve, and present in function to make sure there's no backflow of blood into the ventricle itself. Now, if you're wondering about these branches, there are 3 branches off of the aorta, and they break into smaller vessels. The first becomes the brachiocephalic trunk. The second becomes the left common carotid, and the third becomes the left subclavian. And you don't have to remember those names. Just as long as you are familiar with the aorta, that will be adequate. All right, and then lastly, let's talk a little bit about these purple dotted lines here. So they represent the aortic sinuses, and the aortic sinus is basically a sac-like dilation at the base of the aorta that allows for flow of blood into the coronary arteries. So the coronary arteries are going to branch off of there, and we'll talk a little bit more about them in the next video. So for now, just keep in mind that they're kind of hidden behind the aortic semilunar valve when it's open, and then when it's closed, the blood can flow into the coronary arteries. And then, of course, just to complete the circuit, once the blood has flown through the aorta and had the ability to travel all throughout the body, it will come back and again flow into the SVC, IVC, and coronary sinus. And so we just sort of repeat the flow of blood over and over again. So that's all for our orientation to cardiac anatomy. I hope you enjoyed it. Thanks for watching.